All right, awesome. Welcome to day 2. I hope everyone enjoyed their sessions. For those that are joining us online and that may not have been with us yesterday, my name is Kisha Shanks. I am the executive director with Yemoja Wellness Group LLC here in Milwaukee, Wisconsin. I am a 12-year case manager, social worker, and certified infant mental health consultant. So just a little background on me. I've been working in case management with in maternal and child health for the last 12 years. And that's what I'm here to talk to you guys about today. This is technically going to be a part 2, but I'm just going to briefly go over some of the things that we went over yesterday because I recognize that there were some people, because it was posted as a repeat session. So may not have been here yesterday. So we're just gonna go through some things first. Ultimately, at the end of this presentation, I really hope that everyone understands the need for unlearning racism and implementing anti-racist methods in their work. We are going to brainstorm some ideas today to really work on dismantling violence in our workplaces against mothers and babies. And identify and examine some of our own cognitive dissonance and how it helps fuel systems that perpetuate the inequities that we see today. Also, we want to explore the historical trauma of racism and its effect on maternal and child health today. Hopefully, when you leave here, your cultural capacity will be increased, your self-awareness will be increased, and your overall knowledge base of the problems and the nuances of the things that we are seeing in our work and in our communities, how those things come to be. So just racism, we know racism is prejudice, discrimination, or antagonism directed against someone of a different race based that one's own race is superior. That's the textbook definition, but we all know that racism is really something a lot more complicated than that. It's not just as simple as I don't like you because you're Black or because you're Latino or because you are a West Indian or what have you. It's a power that comes along with it where I can systematically and intentionally exclude you from spaces and opportunities simply because I don't like you, or I feel that you are not deserving of those things because you are different than me. So this is how racism shows up in our systems and in our government, in our programming, and things, because it's rooted in everything that we do. And it's become a part of who we are. It is very much cultural based. And what I mean by that is that racism has a culture in and of its own, and it takes on its own identity. And when we're talking about systems, we tend to think of systems as these mythical beings that just exist, and we are not a part of it, but we are all the system. The systems that we are looking to dismantle, the systems that we are looking to create, that is each of us in this room, each of you watching online, everyone in this world is a part of a system of some sort. Systems are made up of people. So just briefly, we're going to talk about the history of racism and where that intersects and how it impacts race and reproduction. So as we know, slavery existed from 1619 to 1865. During slavery, midwifery was a medical domain that was really controlled by women. Black women, enslaved women, did not have prenatal care. They did not receive medical care. What they received was the care and nurturing of other elder Black women that oversaw the birth of their babies. The care throughout their pregnancies, that was virtually non-existent unless there was some sort of problem that had presented itself, and at which point there was an elder Black woman on the plantation that would kind of oversee what was going on and give advice and help to deliver the babies at that time. It is important to note that during slavery, pregnancy was no expectation or no exception for output. a pregnant woman was expected to do the same amount of work as a full adult man. There were no differences based on age, gender, or anything. So if you had to pick 50 pounds of cotton a day, a pregnant woman was expected to pick 50 pounds of cotton per day. Also, it's important to note that there were numerous food inequities during slavery, and there were no exceptions made for pregnant or lactating women either. So whatever your rations were for that day, if you even received your rations, that's what you got, whether you were pregnant or not. And also, it's important to note that reading and writing was not allowed in Southern states at all. So during slavery, it was illegal for someone to read. Why is that important to health and birth outcomes? Because we know that education and there's a direct correlation between education and the health of a community. Communities that are largely unhealthy are largely the most uneducated. It wasn't until 1808 when Congress banned the importation of Africans and enslaved Africans from Africa. So at that point, that's when the United States really became heavily reliant upon birth. We had to, bodies on the field equated money, that was revenue. So they were no longer able to bring bodies over, people had to have babies. And that's when breeding really took off on the plantations. Doctors and schools partnered with slave owners to advance their medical knowledge under the guise of treating reproductive ailments of enslaved women. It's important that we understand that, as I stated earlier, midwifery and the practice of and birth, that was something that was completely done by women. Men were not in that space at all. It wasn't until 1808 that the birth and reproduction of enslaved women was so important. It became so important that men entered the space. And that's when the field of medicine and gynecology really began at that point. And it's important, let me just read a quote here. Male midwives relied on the bodies of vulnerable populations like the enslaved and poor to advance their medical research, to create effective surgical procedures to cure women of formerly incurable gynecological conditions, and to a lesser degree, to provide a pedagogical model for physicians who were interested in understanding what they believed to be biological differences between Black and white women. I want you all to think about that statement, what they believe to be biological differences between Black and white women. Because at that point in time, it was believed that there were biological and fundamental differences between Black people and white people. These beliefs were the justification for the unfair and inequitable treatment of Black enslaved Africans at this time. So as we advanced into the field of gynecology, Marian Sims, who is the father of gynecology, became so because he experimented on Black women. That means that he performed surgical procedures on enslaved Black women without anesthesia or any type of comfort, and did them at his own whim. Deceased and living Black women's bodies were profitable. A body on the field was money in the bank. So diseased reproductive organs of Black cadavers were routinely used to facilitate research and to provide education, again, without permission, again, without, and it was done in a very inhumane manner. And it's also important to note that during pregnancy, an enslaved woman was not exempt from any consequences for quote unquote misbehavior. So that means that a pregnant woman could be hung, she could be beat to death, she could be sold or have her children sold as a punishment. And in some instances, in many instances, were susceptible to losing limbs. This is just an example, a visual representation of birth trauma and how it all began. And the reason I'm going over this and explaining this to you all, because I really want you to connect the dots between then and now. I want you to be able to draw parallels between the things that were happening then in the things that we are seeing now, because racism is very much violence. It is inherently violent. And so these justifications that we see then, or that we saw then, are the same justifications and the reasons that we're having the outcomes that we're having right now. Thomas Jefferson, one of our founding fathers, said, "I consider a woman who brings a child every 2 years more profitable than the best man on the farm." So think about that. And when we look at the profit in poverty, we think about how profitable Black birth is in this country. When you look at mass incarceration, the prison pipeline begins in the womb for Black women. And being born enslaved means that you have essentially no autonomy over your health, over your body, or over your children. So Black bodies were for the purpose of work and breeding. If you were not having babies, you were useless. If you were not lactating, women were not allowed to breastfeed their own children. They had to breastfeed the missus' children. And so here you have an example, a picture of a woman, an enslaved woman breastfeeding a white child, and it was illegal to breastfeed them from the same breast that they breastfed their own children from, if they were even allowed to breastfeed their own children. And some of the things that we practice today, like putting K-Rose syrup and things like that in baby bottles, this is where it comes from, because our babies were forced to starve while our mothers were feeding white women's children. Our babies we had to come up with other things to sustain life. Oh, and the other picture shows how is depicting basically a baby being sold right from their mother's arms. There's a lot of parallels that we can draw from that image alone today. Also, slaves were not slaves were not issued birth certificates. Instead, birth records were kept on slave ledgers, on the business ledgers. So being property, slave women had no legal claim to their babies. Slave owners owned both their bodies and their children's bodies in perpetuity. So what that means is essentially forever and ever. So any children that their children had, any children that those really, there was no connection between mom and baby. It was the mom and the baby was something else. They didn't realize the impact on an unborn child from the stress that mothers felt. But what they did realize is that if a woman was beat too harshly while she was pregnant, she would lose the pregnancy. So what they decided to do was dig ditches in the ground and force the women to lie face down, and they would beat them that way as a means to protect the unborn child, not considering the emotional and physiological damage that it was doing to the unborn child at that time. So because all of these things happened throughout slavery, there's generational maternal disassociation. So slave women and their children were regarded as separate entities, and slave women who bore children fathered by their masters were often subject to gross mistreatment and almost guaranteed to be separated from their babies at birth. This was almost always the decision of the mistress of the plantation. We all know how that goes. White gaze, wife probably doesn't like that too much. So the maternal disassociation is that in order to survive, you had to be disconnected from your children. You could not love your children. You could not nurture your children. You could not hold your babies, play with your babies, teach your babies. Your babies were just birth became something, it was a biological function. It was just something that you did, and you had absolutely no relationship or no connection to your child, because any connection or relationship would result in you guys being separated. And also the absence of fatherhood. When we're talking about birth outcomes, the presence of fathers is important, but during this time, fathers were not allowed to be present. Um, Enslaved Black women were regarded as heifers, and the men were essentially bulls. There were many, many instances, countless instances, where people were forced to breed just based on their physical stature. So they were put in the room together and they were expected to make a baby. If they did not, they would be beat, sold, or worse, killed. Slave men were often forced to breed with slave women, and failure to do so would result in being sold or death by torture. Slave men were often forced to watch their wives raped by white men to enforce authority. And sometimes these men were also sodomized to do the same. And that's called buck breaking or breaking the buck. That is also another reason why there is a great homophobia in the Black community as well, which we're not here to talk about that, but let that simmer a little bit. And just to give you an idea of how important Black babies were not, they were often used as alligator bait and disregarded as disposable, honestly. I want to skip past that. So when we look at racism, we understand in racism and reproduction and birth how violent that institution was. And when we think about the lack of resources and the element of scarcity that was created throughout slavery and even at emancipation, because once emancipation came, we were essentially freed with nothing and no access to nothing. We didn't have the resources, the tools, or the education to sustain ourselves. So even going back, education means emancipation. It means light and liberty. It means the uplifting of the soul of man into the glorious light of truth, the light only by which men can be free. To deny education to any people is one of the greatest crimes against human nature. That's a quote from Frederick Douglass. So when we look at poverty, it's a moment of scarcity. And scarcity is basically having scarce provisions to provide for your basic daily needs. It's an inadequate supply. It causes famine, an inability to maintain a minimum standard of living. So that's food, clean drinking water, shelter, clothing, healthcare. It's a relationship between survival and a capacity to do so. And it comes with various characteristics. People who live in severe poverty and have been raised in poverty, they have a sense of hopelessness. They are socially isolated. They have poor housing conditions, inadequate socioeconomic structure. So you think about just being here in Milwaukee, the county transit system, transportation. You think about the rising cost of energy. So your We Energies bills, education, the quality of the schools in the city, health, the access to equitable healthcare. Having access to healthcare and healthcare being accessible are two totally different things. If you are living at or below the poverty line, chances are you do not own a car. If you cannot get to the doctor, you're likely receiving Medicaid or Badger Care for your healthcare benefits, in which they provide transportation. Good luck getting transportation to your doctor's appointments and to your medical appointments, because you have to schedule so far in advance. And sometimes even then they still do not show up. And all of these things have been compounded with COVID. Safe drinking water. There is still very much a lead problem in Milwaukee. And that's just to name a few. Poverty is a life experience that shifts perceptions, not only of self, but also of the world around oneself. And it creates a culture that thrives on lack. So when we're looking at birth outcomes and when we're looking at infant health outcomes, these are the things that shape those outcomes. So when you look at racism is an act of violence, right? And racism systematically excludes people from the things that basic things that they need to survive. It creates poverty and it creates scarcity and it creates lack. That is also an act of violence. Racism is violent. Poverty is violent. And what it does, living under those two conditions creates further conditioning. You adapt to being in those conditions. You don't know anything but those conditions. Even if you are put in a situation or given an opportunity, so to speak, to get out of that, you will more than likely make a decision or make a choice that is going to keep you back to what it is that you are used to. And that is what we see conditioning. A lot of us are working in social services, working in healthcare, mental health, and things. And we may become frustrated, like, man, why are they doing this? Because they don't know anything else. When you are constantly under stress, when you live constantly under duress, and you constantly live under the stress of not knowing what your day to day is going to be, having peace and having stability and having peace and stability is very uncomfortable. And so what do? You make choices that recreate the chaos because that's what you're used to. And that's the only thing that you know how to thrive in. So we're going to skip past that. Briefly, I want to touch on racism and the developing brain and how it all impacts and how these things all come together. So during pregnancy, we all know that everything that mom experiences during pregnancy, baby experiences, and it also impacts the development of the unborn baby. This is where infant mortality and birth outcomes come in. So in addition to all of these external factors and healthcare matters, there's also the physiological side of it. So women that are under chronic stress during pregnancy, and this is important to note that it's not just about poverty for this instance, because we're seeing high infant mortality rates even amongst those that are in an advanced socioeconomic position. So women that have degrees, two-parent homes, are high income earners, are experiencing pregnancy loss and infant loss just the same as those without. And the common denominator in that is racism. So when you're thinking back to the ideas that Black and white women biologically were different and were capable of things, are capable of different things, that translates into how women are treated in healthcare settings today. And these things impact birth outcomes. But having in a developing baby, chronic stress limits gray matter in the front and parietal lobes. So your frontal lobe, that is your processing center for, this manages all of your cognitive functions, such as problem solving, organizing, and controlling your impulses. Your parietal lobe, or I'm sorry, is on the side. This is what processes your sensory information. How do you receive the world how do you experience the world that's around you? If your frontal lobe and parietal lobes are smaller, that limits your capacity for receiving input, and you don't have much control over your impulses. It's hard for you to manage your emotions. A smaller hippocampus is central to stress response, memory, learning, and the autonomic nervous system. So that's where we start talking about the fight or flight. That's where cortisol comes in. You're crossing the street and a car comes out of nowhere and you jump and you get out of the way. That's cortisol, right? When you're living in chronic stress, you have that cortisol rushing all the time. You're constantly in fight or flight mode. And a lot of times those things are heightened by our diets. A lot of us culturally, Black people consume diets that are high in sugar. So whether it's actual sugar or it's foods that our bodies break down and turn into sugar, such as, the macaroni and cheeses that we love so much, the cornbread, potatoes, candy yams, all of that stuff. Those things are, they create a buildup of sugar in the body. Sugar is the vehicle that gets cortisol throughout our bodies. So when we're experiencing racism, we have a doctor's appointment, we get nervous because we don't know, we can't say the wrong thing because that could be trouble for us, right? We can't necessarily ask questions because we don't feel empowered to do that. So what do you think is happening physiologically in our bodies? We feel that stress and we feel that confusion and that angst in our bodies. That's cortisol going. That's that hippocampus firing. When you're in that state, it's kind of hard. It's just like if you have sugar every day, or if you drink coffee every day, and then you go a day without coffee, you're about to lose your mind because you feel it in your body. It's the same thing with cortisol. If you are accustomed to having high cortisol levels, you feel it in your body when you don't. And so what happens? You've been conditioned to do something that will create that rush all over again. Smaller amygdalas, that's a response for emotional processing and social information. These are things that can lead to childhood depression, mood, and or behavior issues. So these are some of the impacts that we're seeing from some of our youth today, because these things start early on. These things start in utero. They start in infancy, few months old, 1 year, 2 years, 3 years old. Many of you are working in early childhood education, and you see children that are just wired and incapable of processing emotion. They're fighty. They don't listen. They're, you call them bad, when what it is that they haven't really been given a fighting chance, and they're surrounded by adults that also were not giving us a fighting chance. So now they replicate what it is that they know. So this is an example of the brain development of a 3-year-old child. So on the left, we see normal development, and then we see one of extreme neglect. So by extreme neglect, that is chronic stress, that is letting babies cry it out, that is not being held, not having your needs met. Those things have an impact developmentally on babies' brains. And this is just a little bit more information. Diminished function of the temporal lobe. So that's what holds the primary auditory cortex, which receives sensory information from the ears. So you have a lot of children that have hearing tubes, have tubes in their ears. Where do you think that comes from? It also processes, this is where you process speech and auditory, your language processing center. So it also has a significant impact on your memory. So when you have to tell kids over and over again, part of that is just developmental, because small children just don't remember anything anyway, because their brains are still developing, but their capacity to develop that over time is diminished when these centers of the brain are underdeveloped. The unfortunate thing is that these are things that no one would ever know until your child is probably 5 or 6, 7 years old, and they may or may not get an ADHD diagnosis. A lot of times children are diagnosed as having ADHD and they're put on IEPs, when the truth of the matter is that they are anxious, they are suffering from PTSD, and they have their development has been diminished because they are under chronic stress and trauma at a young age, and have been since they've been in the womb. And these are all things that contribute to poor maternal and infant health outcomes. This is just, I got this from NICAM. This is just a visual of how caregiver trauma, so that could be a mother, father, daycare worker, whatever, can impact the child's development. I'm not going to read through all of that, but I will certainly share it with you all if you want me to do so at a later time. So when we're talking about infant mortality, we're talking about maternal child health outcomes. We know that Wisconsin produces the worst statistics for Black children and Black women and Black people in general in the entire country. And largely it is, those numbers really come out of Milwaukee, but we have to say the entire state for the sake of argument. Milwaukee County, we have the highest Black male incarceration. Milwaukee County has the highest infant mortality and maternal mortality rates amongst Black women and babies. Black women and Black babies are between 3 and 5 times more likely to die during childbirth or within that first year of life than any other race in this state, in this city. Milwaukee also has the lowest reading test scores amongst Black children. And it's no coincidence that the poverty rate amongst Black families is 5 times higher than whites right here in Milwaukee County. What does that mean? Well, let's look at it. We talk about the health of a community. A health of a community depends on education, depends on access to fresh water. It depends on transportation. It depends on opportunities for economic development. It depends on nutrition. Milwaukee is the most, or Wisconsin is the most segregated state in the country. Milwaukee is known for its food deserts. So when we're talking about nutrition and we're talking about sugar, consuming sugar, and we're talking about cortisol levels, food deserts, what do people eat most? When you go to the grocery store or you see people at the corner stores all the time, because that's where most people get the bulk of their food from, the neighborhood stores. What do they sell there? Ramen noodles. What are ramen noodles composed of? There's probably 3,000 milligrams of sodium in ramen noodles. Our children are malnourished. They're eating ramen noodles, Takis, chips, sugar juices. And these are all things that are cheap and accessible, but they hold no nutritional value whatsoever. So we're living in a city where a large population is underpaid, so they don't have the economic resources. They don't have access to fresh food. They don't have access to fresh water because we know about the lead issue that is still very much an issue in the city. Redlining, evictions, and poor housing conditions. Homelessness is a huge factor in maternal and infant mortality. You have no idea how many women I've worked with that were homeless, and not categorically homeless because they were not housed in a homeless shelter, but homeless because they did not have a place of their own to sleep. They were transient. They were living from one house to the next. They were couch surfing. A lot of the initiatives for infant mortality have been aimed at offering soft or safe sleep and providing baby beds. What good is a baby bed going to do to a mom that doesn't have a home to put a baby bed in? Reduce public transit routes. How are people getting around? How do they get access to the things that they need? As we've mentioned before, there's a number of food deserts in the city. How do people get fresh food? Having a public transportation is all fine and dandy, but how does one afford bus tickets? A bus pass for a month is running roughly $100 per person. So how does that become? So that distinguishes the difference between access and accessibility. We all have access to the things at this point, but everything is not accessible for us. Unemployment and underemployment. I was born and raised in this city. I remember when the city was flourishing. There were tons of manufacturing jobs and things like that in the city. People lived in the city. They worked in the city. They raised their kids in the city. They were educated in the city. My grandparents migrated from the South because of the opportunities in this city. And during my lifetime, I've watched it all go away. How are people supporting themselves? The jobs are gone. The schools have diminished significantly. We have voter ID laws that keep people from participating in the democratic process. We have unfair policing that leads to the over incarceration of Black men and women. And these people, these men and women are released from prison with nothing. So it's kind of like how emancipation happened, right? They said, oh, we let you guys go. You're not slaves anymore. Go on, be free. But didn't give them any tools or resources to sustain. And we see the same thing with people exiting the criminal justice system. Inaccessible healthcare. Yes, you can get transportation to a doctor, but good luck getting an appointment. If you have state insurance, you likely are not seeing a dentist because most dentists do not accept state insurance. And if they are accepting state insurance, you are subject to substandard care. And it will be months before you are able to get an appointment, unless you are experiencing some sort of dental emergency. We won't talk about, well, actually, we will talk about the amount of racism and inequity that we experience within the healthcare system. We are not empowered to advocate for ourselves. We are not empowered to ask questions. We are criminalized for just about any and everything. White people go to the doctor and say that they're in pain, they get narcotics. We go to the doctor and it's automatically assumed that we are drug addicts. There are a lot of babies being born in hospitals here that are drug tested the day that they are born. Why are they drug tested? Because mom may have come to a doctor's appointment and smelled of marijuana. Or mom may have just been honest in her care, as you should be with your medical provider, right? Because it should be a safe space, right? And say, you know what? I'm having a hard time keeping food down and nothing that I do is working. But when I smoke weed, I have an appetite and I don't throw up as much. So rather than addressing that, they make a note in their chart that mom smokes weed during pregnancy, and that's a horrible thing to do, right? So when baby is born, baby is drug tested for marijuana. If marijuana and opiates, if the test comes back positive, social services and CPS is at that mom's door before she leaves the hospital. And there's high gender disparities, which we won't get too far into that. So all of these things, when we're talking about the violence in these various systems and racism and poverty and how all of these things intersect and impact birth and infant health outcomes, how has COVID impacted all of that? So a lot of people are under the impression that COVID just came along like a wrecking ball and just toppled everything over. I'm here to give you all a little bit of a news flash. It was already up. Stuff was already messed up. Communities were already isolated. Communities were already dealing with a lack of resources. Communities were already receiving substandard education and were stressed and anxious and angry and hurt. All of these things were already going on. COVID just came along and kind of made it a little bit worse. And it really speaks to the resilience of Black people, because some of our poorest families were actually doing a lot better than some of us that have had access to all of the things all along or had more access. They were able to create, Mayor Lumumba spoke about it yesterday, about cooperative economics. I had families that it was 12 of them living in one house. And they had another family member that had maybe 8 people living in their house. So they would gather food boxes and share food and pass meals and things like that along to kind of sustain. And if one person got masks, they would share the masks with the other families. And so they were able to create a system that sustained them within that. But COVID definitely impacted and increased the isolation that they already felt, because we've already established that poverty isolates you from the rest of the world. You don't have access to the things. You're not regarded as important or as a worthy contributor to society. So you're already isolated. And with everything being shut down and during quarantine of COVID, people were cut off from the little bit of access to the things that may have sustained them, such as community centers, libraries, schools. So it was kind of funny. So there were a number of parenting groups and blogs that I follow and that I'm a part of. And you had so many moms, white moms, privileged and affluent moms, resourceful mothers, complaining about how hard it was to parent during COVID and how they were just stressed out. They didn't have, the schools needed to open. That's been a big thing. The schools need to open. And they were expecting all of this sympathy, and they were given all of this sympathy and consideration. Like, yeah, it's a really hard time. I'm struggling too. And it's funny because these are the same people that probably 2 months prior to the world shutting down would say things to you or I, the Black people in this room, saying, man, I'm so tired. I'm just stressed out. Well, why you sit up there and have all them kids then? What you having babies you can't take care of? Well, you're a mom. That's what you signed up for. Why is it so hard for you to take care of your kids? Meanwhile, you had women that were, had 3, 4, 5 kids, and they're trying to figure out how to homeschool all of them. At this point, I think COVID kind of made people realize that your resources really don't make a difference, because anything can come along and we can all be in the same position. The difference between some of these families and the families that struggled the most is that they were able, they practiced their own form of cooperative economics. So they were able to set up, I forget the term, but they had study groups where the kids would get together and study, or help them with homework. Some were hiring nannies because they couldn't send their kids to daycare, but they were essential workers, so they still had to work. But what happens with someone that does not have the income for those things? Daycare centers shut down, and many people receive daycare benefits as a part of a state subsidy. So where do they get childcare from? One of the other impacts of COVID was that there was limited or no access to birth support. So women that had doulas and birth support and partners, things like that, they were not able to have any of those things with them when they gave birth. They gave birth in mass. I sat on FaceTime on video chat with quite a few women while they were in the hospital because I was not able to be there with them. So they had to go through that process alone. There were instances where mom was not even allowed to FaceTime in the room because it was a distraction to the medical staff there. So they said. So imagine what that must feel like for someone giving birth and someone having questions and not knowing what's going on, but not really being empowered to say, I need help, or I don't understand what's happening, or I'm scared, or can you just be in this with me for this moment? There were no in-person doctor visits. That was a huge thing because when we're thinking about medical care, being Black, we already have inequities in that system, right? Our concerns are already disregarded. We don't feel empowered to ask questions. Our concerns are not validated at the rate of white people. It's assumed that we don't understand what's going on. And if there is a language barrier, people don't know medical staff, medical professionals don't always know how to talk to us. So how going from a face-to-face model to a virtual model, how can you properly assess me and my condition and what I'm going through if you're not you're not sharing space with me? We're not able to exchange energy. You're not able to put hands on me. What does that look like? And a lot of times, you're at the mercy of the technology that you have. We know that resources, having internet at home is an issue. Many families do not have Wi-Fi at home. They were at the mercy of their cell phone carriers or things like that. So we've seen significant mental health declines during COVID, increased chronic stress, so diminished access to community resources, increased food insecurity, compounded housing insecurity, public transportation was less accessible, and there were inadequate supply of masks. There were community organizations handing out masks, but let's just be honest, what is one mask per person going to do in the middle of a pandemic? That mask was probably lost or something by the time they got home. So that limits someone's ability to even leave their house. Increased depression and anxiety. COVID was in the news 24/7. Not to mention the fact that everyone was stressed out, depressed, isolated. So tempers and moods were on high to begin with. So we've seen increased community violence because of that. Car thefts, shootings have gone through the roof. Domestic violence, including child abuse, have been increased. You have a lot of people that really aren't accustomed to having their kids full time. Your kids are in school most of the day, and then after school, they're in some sort of after school program, whether it's CLC or they've got some activity or something, sport that they're playing. So your children aren't at home with you as much. So it's forcing people to parent in a way that they are not used to parenting, and that can be stressful. All of those, there were no considerations given for those things. And also just being confined to your house. And we know that homelessness and transience is a very big issue in this city. What does that look like when your home isn't comfortable? What does that look like when your home isn't safe? When your home isn't insulated, because the winters here are brutal. I told you all about a family that I worked with that had 12 people living in one house. It wasn't a big house. It was maybe a 3-bedroom house. There were 12 people living in this house. The house was infested with roaches. There were broken windows and poorly insulated windows. They did not have furniture. They didn't have adequate beds. Many of them slept on pallets on the floor. How do you learn in that when you're having to do virtual school? Or how do you just live in that day to day? Their escape was being able to go to the community center and have some semblance of belonging and some semblance of normalcy. But all of that was taken from them. So when we're talking about racism and COVID combined, it further denies Black birthers and children freedom of expression, innocence, bodily autonomy, access and opportunity, growth, life, protection, all of the things that we need as basic human beings, all of those things, those human rights that we talk about. Poverty and racism systematically denies Black people, Black women, Black men, Black babies of all of those opportunities to just exist and to exist freely and to exist in safety. Because as I said throughout this, racism is violent, poverty is violent. So when we see the violence erupting in our communities, what we're seeing is really a representation of all the violence that we are experiencing as we are navigating and living through these systems on a day-to-day, COVID or not. So I want us to think a little bit about, I don't know how much time we have. I want us to think about a little bit about what our work needs to look like going forward and how we can shift and pivot in increasing not just capacity, but implementing anti-racist programming and policies within these systems. I, for one, am of the belief that these systems need to be completely dismantled. And there's no way that we can really create safety in the system that is already existing. We have to create something new. And I want you guys to think about the systems that you work in, and even within your organizations. I want you to think about the violence that your organization perpetuates, because your organization perpetuates violence, whether you mean to or not. And as a part of your job, you are required to uphold that. So for me, I'll use my work as an example. One of the violent things of the work that I do is the reliance, because I work so much with nonprofit organizations, is the reliance on evidence-based curriculum. How are we going to create change within our systems and improve these outcomes? Because we've been talking about improving birth outcomes for Black babies and Black women. I've been doing this for 12 years, and I've been talking about this for 12 years, and the outcomes have not gotten any better. The numbers have not shifted. So when we're talking about improving outcomes, but many of the resources that these families are expected to take advantage of rely heavily on evidence-based education. But the evidence, what is the evidence-based? Where are they collecting the evidence from? Because they're not in our communities collecting the evidence. The data isn't being collected on 27th and Burleigh. We see countless press conferences out of Moody Park. They're not in Moody Park collecting data. They're not working with those families of Moody Park. The data, the evidence-based curriculums that they want to bring into that community, the data was collected from a bunch of white kids in rural Ohio. How is that going to make sense? A lot of, yesterday, there was a gentleman here that was speaking about parenting education. There are a couple agencies in the city that work with, that provide parenting education, and most of that parenting education is court mandated. But that organization relies heavily on, they rely solely on evidence-based curriculum. What are people learning? They're learning things that don't look like them and that don't apply to them. How can we teach parenting to people who don't have their basic needs met? How do we teach parenting skills to people who generationally have not had parenting education? We've all got parents, but some of our parents weren't right. We weren't always taught the right thing. So what does that look like? So since I've been rambling, I hope you guys have been thinking about some of the violence in your systems, within the systems that you work in, and how you can dismantle that or disrupt that. Does anybody have any thoughts or an example? And I know I'm asking, putting you on the spot, and I know it might not be the easiest thing to think about, but if we're going to see any changes in our community, we have to really start thinking outside of the box, and we have to push the envelope, and we have to be willing to piss some people off. We have to be willing to, shake the table. As a matter of fact, I don't even think we're beyond shaking the table. We need to flip it over. It's time to flip tables. Mhm. And that speaks to, earlier, I kind of glossed over that slide, but talking about conditioning and that classical conditioning. If you are familiar with Pavlov's dogs and how he presented a bell and meat at the same time, and the dog would salivate. And at one point in time, he removed the meat and just rang the bell, and the dog would salivate the same way, as if the meat was present. Um, a lot of people, a lot of us have been conditioned to do certain things. So you you learn through positive and negative reinforcements. So if you are quote unquote reckless with your money, and I use that term loosely because a lot of people, when you're living in poverty, is you really can't be reckless with your money, because it really doesn't matter what you spend your money on. You're going to go without something because you just don't have enough anyway. So the assumption is that, you know, this person coming before you is irresponsible or reckless with their money. And they do these things and they say, oh, well, you know, I can go here and get this assistance. And they get the assistance and they become reliant upon that. Because if they don't, and they figure out a way to not need the assistance, you know, they, any other help that they may be getting will get yanked from them. There's been countless instances where someone is receiving food share and they make $5 more than the minimum amount, and they're completely kicked off, or their food share amount is reduced and they need that money. So they lose $400 in benefits because they made an extra $5. Make it make sense. That's an act of violence. The food share program and just the how they go about qualifying people for these programs and the things that they require, so that cause people to get kicked off of these programs. They need these programs. And if you're making $5 more, if the income limit is $1,200 and you make $1,205, how does that equate to you not being eligible? Well, I think there's a number of ways. First of all, a lot of these evidence-based curriculums are typically facilitated by university personnel. So there's usually doctoral students um, or those in academics that are facilitating these. They're the ones that come up with the surveys and the research and the things like that, and partnering with community organizations to do this, to gather information and survey. So they could very well partner with, say, for example, Social Development Commission, and as a part of them getting services, they can fill out a survey or be asked certain questions and collect data that way. Another way is to get with schools, but the people, those that are in academia that are overseeing these projects are the ones that really get to dictate where they do their research. Um, and then the specifics, or the what's the word I'm looking for? You know, the matter of getting people involved and getting them to participate, that becomes a small issue, but they have to be willing to come to the communities that they are serving, or at minimum a community that looks like the communities that they intend to serve, and and do that research and collect their data there. There is no trust. So when we think about historical violence and just how it plays out even now, even in maternal and child health, think about how women were experimented on, how their bodies were, you know, didn't hold value, how their concerns, they weren't allowed to have concerns. And I think about the violence that goes on in reproductive health now. You have so many Black women that are suffering from fibroids, adenomyosis, endometriosis, things like that. Those are very painful conditions. And I've had my own challenges with that, where I've gone to my doctor and said, hey, this is what's going on. This is how I'm feeling. It's painful. And the most they would give me is 800 milligrams of ibuprofen. But I know white women that, you know, did not have endometriosis or did not have fibroids, and they just suffered from a painful period, but they were given Vicodin to take during their menstrual cycles. And the excuse that I was given, and that countless other Black women that I've talked to that have experienced the same thing, is that, oh, well, that's the most that we're able to give. You a lie. No, it's not. Because I know you're giving people more. It's no different than when you have, you know, white kids experiment with drugs all the time. They smoke weed. Hell, they grow weed. They smoke weed, they grow weed, they do heroin, ecstasy, acid, all of that. They get caught, they go to rehab. We get caught, we go to jail. And there's a lasting impact on families because of that. When one person goes to jail, everybody in the household goes to jail. Even though physically out here, you think about women who are raising children by themselves because their partners are in jail, and most of them are in jail for something non-violent. They're in jail for a minor drug offense. You got 2 grams of weed and you in jail serving 7 years. Meanwhile, Bill is out here raping children and he gets probation. And he gets to go to a mental health facility. We are systematically excluded from housing, even redlining. Redlining isn't just about not allowing poor Black people in, it's about not allowing Black people that can actually afford to live there in. Home ownership. When you get ready, if you have a home and you want to sell your home, your realtor will tell you to take pictures of your family off the wall, because if they know Black people live there, they're not going to buy your house. So all of these things go back to, you know, this is what we're seeing today is the result of hundreds of years of conditioning when it comes down to race relations and race equity. White people have been conditioned for hundreds of years to think that Blackness is inferior. Black people have been conditioned for hundreds of years to think that Blackness is inferior and that whiteness is somehow greater than. But when we look back over the history and the things that our ancestors have endured and survived, even when I look into our communities now, resilience is one of those things that it's almost a gift and a curse. It's a gift because who else could do this but us, right? But the curse in it is that we are expected to constantly be in that space. We are expected to constantly live and thrive in spite of, not because of. And I'm so over it. I'm so over it. And I really need y'all to be over it too and be willing to do something different. It's not just about giving poor people access to things that folks that have money do. It's about creating an equitable economy to where people can actually earn, because it's not like people are dumb. It's not like people are incapable. It's not even that people don't want to work. But again, when we talk about conditioning, when you've constantly been told that you can't and that you are incapable, and the resources and the tools that you are given are less than or inadequate or just non-existent, what are you supposed to do? What do you think about yourself? How do you elevate beyond that? And how do we support one another? Because, you know, when we see one person elevating, we don't necessarily see that, oh, well, that's something that I can do too. We think, well, the nerve of of them. I'm not gonna get into that too much because this is a mixed space. So I'm gonna save that for another time. But yeah, we have to really be willing to do the work, and we have to really be willing to do our own individual unraveling, because I'm sitting here talking to y'all about this, but I have my own struggles too. Everybody sitting in here has their own struggles. We're all a paycheck or two away from being homeless or being in poverty. I mean, right now, unless you're making over $100,000 a year, you in poverty anyway. And to Mayor Lumumba's point yesterday, when he was speaking about the difference between, with the elections, a lot of us, our condition didn't change depending on the presidency. That meant nothing. But the idea of whiteness and blackness lets folks think that having somebody else as the front person of this country is gonna make a difference and something is gonna change. You know how many white people are voting against their own interests right now just because they don't want to see anybody black in power? It's insanity. So we see those same things that happened during slavery, those same thought processes, those same ideas and traditions. The inequities that they created then, they're creating the same inequities now. It just look a little bit different because we're not in physical chains anymore. But the way the system is designed, the prison industrial complex, poverty is very expensive to be poor, and poverty is very profitable. Poverty is what fills jails. Jails is what gives supplies free labor. You know how many companies contract with the prisons to get free labor or reduce labor? Meanwhile, you barely working and trying to put money on your cousin canteen. We got to do something different. And we know what it is, but we got to, not be afraid to do it. Got to flip the table. We got to flip the table. I'll share a little bit more once, the cameras and stuff go off. But but y'all picking up what I'm throwing down. Y'all know what we need to do. So what I want y'all to do going forward, because I think we got to get out of here over time. I want you to think about how internalized racism shows up for you, and how and just what it looks like in your life and what it looks like in your work. Because the first step to dismantling anything within these systems is that we've got to do the work on self. Community starts in your house. It starts in your heart. So that means working with your kids and not just doing the things because we've been so accustomed to not having, that we think that by giving our kids the things that we're doing something. When our kids need emotional support, our kids need a safe space, and that is created in the home. I was born and raised on 4th and Vienna, which is right off of Keith. I grew up in the hood. I had many a night where I got on the floor in the middle of the night because gunshots were ringing out. But one of the things that sustained me is that my house was in the hood, but the hood wasn't in my house. There was a lot of love in my house. There was a lot of support in my house. There was structure in my house. It wasn't always peaceful because we got cussed out a lot, but but you get what I'm saying? We have buffers and things like that. So doing that internal work and that self work to be better people, parents, mothers, aunts, uncles, grandparents, cousins, all of that, doing that work. And then those things will start to be reflected outward in the community. And then also think about, even in terms of your work and your own personal enrichment, what challenges are you going to face in doing that? Who's going to be your support person? Who's the person that will hold you accountable when you say, this is what I want to do? Who's going to be the person or the people that's going to get in your way? And how do you navigate that? And then really just continuing the conversation and bring it up and think about these things in the back of your mind and draw those parallels when you see certain things in policy or in healthcare or things like that that have an impact on families and children and even yourself. When you think about historically how these things have played out, when you start to see that happening, be like, hey, this looks like this, and so we got to do something different, because we keep doing the same stuff and with different faces and getting the same results. And it's just either we're going to talk about it or we're going to be about it. That's it. There's me. My contact information, please feel free to connect with me on LinkedIn, Facebook, or Instagram. My email is yemojawellness@gmail.com. If you've enjoyed my presentation or anything, please feel free to give me an endorsement on LinkedIn. I appreciate that. I welcome any feedback that you have, any questions, concerns. Feel free to reach out to me. And thank you for your time.